Attention real estate investors. Are you looking to diversify your investments in a growing industry and collect frequent income? You should check out Image Studios Salon Suites. We offer an investment opportunity where real estate comes together with beauty and wellness. We rent turnkey studios to beauty professionals and are on track to have over 100 locations open this year across the country. Image Studios is a unique investment opportunity, and we're building an incredible team of high-caliber entrepreneurs from coast to coast. We're the leader in the industry and poised for tremendous growth. Interested in owning your own Image Studios franchise? Contact us today. Visit imagestudiosfranchise.com to find out more. That's imagestudiosfranchise.com.
Gives you a closer look at the events that happened around Maine this week.
Good morning. Thanks for joining us. I'm your host, Cindy Campbell. Flu season is here, and with it this year, an early uptick in RSV. So I chatted with Dr. James Jarvis of Northern Light Health about both viruses, what the symptoms are, how to avoid getting sick, and when to call your doctor if you do get sick.
So, Dr. Jarvis, this morning I want to talk about the flu, and then we'll talk a little bit about RSV. Is there a lot of influenza in Maine right now?
There is. In fact, we're seeing a significant increase over the last 2 weeks in cases of influenza. Thankfully, most of them are being handled at home, and that's good news for us, but we have seen an increase in hospitalizations as well. But we like to keep those numbers as low as possible.
Now, I know several families that have been affected by influenza A. Is this a stronger strain of influenza, or is it just another name?
Yeah, it's a little bit too hard to tell right now. So typically during the year, we will have a few strains of influenza A and at least 1 or 2 influenza B strains. Typically in Maine, we don't see influenza B until the end of winter, early spring time frame. So right now we're not dealing with influenza B. We are dealing with an influenza A strain. It appears to be one that is covered by the current vaccines that are offered. So that's good news for those of us that have gotten our vaccine. And it's a reminder for those who haven't that it's really time for you to get your flu shot.
And that really is the best precaution, isn't it?
Absolutely. Vaccination is the single best thing that we can do to help prevent the spread of respiratory viruses that have vaccination. So right now, the biggest ones there would be influenza and the virus that causes COVID-19. And so we strongly recommend that. But in addition to that, we should be doing all the precautions that we've talked about for almost 3 years now in terms of protecting ourselves from COVID-19, which is good hand washing or hand sanitizing, coughing or sneezing into your elbow or into a tissue, or wearing a mask when we're out in public, particularly if we're going to be in an indoor location for a long period of time. And then also importantly is staying home if you're not feeling well. Right now with the 3 viruses circulating around, influenza, COVID, and RSV, it is really taxing our systems in order to take care of healthcare issues for people for reasons other than those 3 viruses.
Right. So what are the common symptoms of the flu?
So typically the difference between flu and we compare that to a cold is that both of them can cause runny nose, can cause sore throat, cough. But typically the influenza virus causes fever and a higher fever than we see with a cold. And then really the hallmark is that it causes really to have muscle aches and joint aches. And oftentimes when you get that fever, you kind of get those fevery chills. And so that's more of an indication that you have influenza. Of course, those are similar symptoms to what we see with COVID-19. And so for people who are at high risk for severe disease from either of those two, we do recommend that if you have those symptoms that you reach out to your primary care provider or seek care at a walk-in care or urgent care facility in order to know whether you have either influenza or COVID-19. We do have readily available treatments for both of those viruses and conditions, and so that's good news for people who are at high risk, or particularly people over the age of 65, or in the case of COVID, people over the age of 50.
Okay, so who is most at risk from the flu?
Yeah, so typically we see a bad flu causing problems in people who are over 65 and in children who are under the age of 5. And so those are the 2 categories that we worry most about influenza, and we want to protect them the most. But we also see severe conditions in people who have chronic medical conditions. So people with diabetes, people with heart disease, people with lung disease, people being treated for cancer, or anybody else who has an immune system that's been compromised by chronic illness are susceptible to the flu and have usually more severe symptoms. And unfortunately, every year we see some Mainers die from influenza, which most of the time is completely preventable just by vaccination.
All right. And so at what point do you say I need to call my doctor. Maybe I'm not able to get over the flu on my own. I need to talk to my doctor.
Yeah, so anyone who has any of those risk factors that I talked about should really communicate out to their doctor when they're not feeling well, particularly if they have a febrile illness or feeling really bad like the flu does. For everybody else, really, for most people, they can get by with just doing some supportive care, making sure that they stay hydrated, using things like Tylenol or Motrin in order to bring their fever down and reduce those muscle aches. But if you're having an inability to keep those fluids down, if you are having any difficulty breathing, or if you're having any symptom that just seems unusual to you, then definitely it's time to reach out to your provider.
Okay. And the best prevention, again, is to get that flu vaccine.
Absolutely.
Okay. So let's move on to RSV. We're hearing a lot about RSV right now, and I've mentioned it to some people, and they say, what is RSV? So I'm going to let you answer that. What is RSV?
Yeah, so RSV is the initials for respiratory syncytial virus. I will tell you, I just say RSV. So RSV is a common virus that causes colds. We see it every single year. Typically, we don't see it here in Maine until we've gotten to late fall and usually not into early winter. But this year, RSV has come back with a vengeance because we've had a couple of years now in a row where we've seen respiratory viruses outside of COVID-19 be suppressed. And most of that has to do with us doing all of those wonderful things about washing our hands, keeping our hands sanitized, staying a few feet apart from people, and wearing masks. But we know that people have stopped doing that. And so now we see respiratory viruses like RSV and influenza come back. So for most individuals, RSV usually just causes common cold symptoms, and they just get over them on their own with very minimal effort and minimal treatment. Unfortunately, people over the age of 65, and particularly children under the age of 6 months, are extremely susceptible to the RSV virus, causing more severe disease in their lungs. And that's where we're seeing problems right now. We have such a high rate of RSV spreading through our towns right now that we're seeing an increase in individuals both over the age of 65 and now under really 3 years of age who are needing to be hospitalized. And unfortunately, some have died from RSV. So that's why it's serious. We currently do not have a vaccine to protect us against RSV. So really, this is another reason why we say stay home if you're not feeling well. If you're an adult and you want to go visit somebody who has a newborn and you have a cold, please do not do that. Please stay home and wait until you're feeling better. Why? Because newborns are specifically susceptible to getting RSV and having severe disease, and we just don't want to see that. Good hand washing is always the key for that. And then, of course, practicing all of those other things that we say to help prevent spread of COVID-19 and influenza also helps prevent the spread of RSV.
Okay. How is Northern Lights Pediatric Department doing with this? Are you being overwhelmed by RSV cases?
So RSV, typically, symptoms only last for a short period of time. And if we're talking about children, most of them get over it rather quickly. And that's good news for us. So what we see is kind of that ebb and flow of days where our entire pediatrics department is filled with children, with many of them having respiratory illnesses, including RSV, influenza, and COVID, and that does tax our system. We've had a couple of times just last month where we have had to delay having transfers in from smaller hospitals to our hospital. But we know all up and down the eastern seaboard, and particularly here in New England, that many of our pediatric hospitals and the hospitals that can care for pediatric children, that their beds have been full. We routinely get calls from outside the state of Maine looking to see if we have bed access. This is a serious issue that we all need to be concerned about. And again, we need to be protecting our most vulnerable, our children. And the best way to do that is those same things we've talked about. Washing your hands, staying home when you're ill, not coughing and sneezing on other people, and of course, wearing masks when we're in a public place where we can spread illnesses rather quickly.
Okay. And is it fair to say that if you or your child are in those risk categories, if you're starting to show symptoms of you're not sure if it's a cold or flu, to contact your doctor?
Yeah, absolutely. Especially if you're having difficulty breathing or if your child is having difficulty breathing. If it looks like they're taking extra effort in order to get air in, you need to call a doctor because kids can turn sick pretty quickly with RSV, particularly those, again, under 6 months of age. But this year, we've been seeing it in children that are 3 and under, and sometimes as old as 7 years old.
How is RSV diagnosed?
Yeah, so we can diagnose it with a test. Most of the time, because we have no clinical treatment for RSV, it's all about supportive care and the individual healing themselves. We typically don't do routine testing for RSV. And for people who have mild illness, again, it's just like a common cold, and therefore we don't need to do any testing. But certainly for children who are at risk or children who are having any severe symptoms, we can do testing and determine whether they have RSV RSV or a number of other respiratory viruses. But typically around this year, we have so many respiratory viruses that are circulating. Sometimes it's hard to pinpoint which one it is.
And can people get more information about RSV on the Northern Light website?
Absolutely. So if you go to northernlighthealth.org, you can search for just about any condition that we've talked about, get more information, and of course you can find out resources where you can get assistance if you need to.
Find more information on flu, RSV, and other ailments at northernlighthealth.org. Next, after last week's wind and rainstorm left tens of thousands of Mainers without power, we wanted to remind you of the importance of protecting yourself from carbon monoxide poisoning. Here's an interview I did with toxicologist Dr. Andrew Smith. What are the symptoms of CO poisoning?
The most common symptoms are things like headache, nausea, vomiting, dizziness, drowsiness, and confusion. But if the levels are really, really, really high, which can happen sometimes, a person can actually be overcome in minutes without warning, resulting in unconsciousness and even death. The thing to remember about carbon monoxide is it basically displaces the oxygen in our blood and therefore deprives organs like the heart, the brain, of oxygen. And so we all know we can't function that long without enough oxygen.
Right. So if you think you've been exposed, if you start showing some of these symptoms, what do you do?
And for example, if your carbon monoxide detector in the home goes off, which would be another sort of sense that you have an issue to be concerned about, the advice is the same. Immediately get outside to fresh air. You call 911 and you do not go back into the building until the fire department tells you it's safe.
And that's an important one. Don't go back in.
Don't go back in until you have someone, because many fire departments are going to have a device that they can bring right to the site, and they're going to be able to tell you how much carbon monoxide is in the air.
All right, so let's run through some of the ways people can get exposed to carbon monoxide. The first thing everyone thinks of this time of year, I think, is generators.
Generators are almost close to sort of, 20% of the poisonings we see. The big thing with generators, and when I'm talking about generators, I'm talking about the gasoline-powered portable units that you sort of roll out when the power goes out. They're incredibly helpful devices as we try to get through being without power, and important to use. But what most people don't realize is that a single gasoline-powered generator releases as much carbon monoxide as found in the exhaust of 100 cars.
Wow.
And you wouldn't want 100 cars idling just outside one of your windows or doors, and you certainly wouldn't want to leave 100 cars idling inside your garage. So the key message here is you need to have that generator outside in fresh air, more than 15 feet from any doors and windows, with the exhaust pointing away from the house.
Okay. So for people who say, well, I put it in my garage, but I had the big garage door up.
One way to think of it is it's a little like playing a game of Russian roulette, if you're familiar with what that is. Maybe 9 times out of 10, you can do that and you won't have a problem.
Right.
But it really depends on what the wind is doing and also what's happening with airflow in that garage. Because your house is warm and warm air rises, and so that as it rises, it has to get air from other places. So if you have an opening between your garage and your home, you're going to just suck that air right in.
Right.
The other concern is if you get levels really high in the garage and you go out to refuel. As I said, if the levels are high enough, you can be overcome in minutes. And that we've actually had cases of poisoning like that of people losing consciousness when they just went out to refuel the generator. So you may have gotten away with it, but you're really doing something that's pretty risky. That generator should be outside.
Right. You got away with it this time, maybe not next time.
Right. Which brings to an important point is you want to have a good plan in advance as to how you're going to safely operate that generator. So when the power goes out and it's raining or snowing and it's dark, you're not thinking, oh, I don't know what to do, I'm just going to leave it in the garage.
Right.
If you have a good plan before to think about where you're going to place it so it can be safely, make sure you have enough extension cord if that's what you're using, make sure that you've got a way to keep the generator, protected from the elements, so it tries to stay dry. You just get your plan ahead of time rather than trying to do it at that moment when you need it.
All right. Now, talking about power outages, I know there have been instances in the past where people think, oh, I'll just bring the grill inside and it'll warm the house and we can cook on it. Not a good idea.
Not a good good idea. Really, any sort of combustion device is going to be producing carbon monoxide. Those that are inefficient are going to produce more carbon monoxide. And then if you think of something like a grill, especially like a charcoal grill, that's going to be really a very risky thing. Plenty of documentation and literature about people being poisoned by bringing charcoal grills into the garage, for example. And the propane grills aren't going to generate as much carbon monoxide, but you're still bringing something that's generating carbon monoxide into an enclosed space, and that's the sort of thing you want to avoid.
Right. Cold days, you will go out in the morning, you want to warm up your vehicle, pull it out of the garage.
That car is going to be sitting there idling, generating carbon monoxide that's going to build up in your garage. But frankly, this time of year, what we see for poisonings more than the vehicle being left running in the garage, but people working on motors and engines for various reasons, whether it's you're trying to get that snowmobile running again, or maybe tuning up your snowblower, or working on an old car. All have been examples of people having those devices running too long in an enclosed space. Some of these produce a fair amount of carbon monoxide. It builds up, and then people get poisoned while they're actually out there working on it.
Okay. And again, probably not a good idea to be using it in the garage, even if you have that big door up.
Even if your big door up, right, you're going to have to really worry about whether or not you're able to get enough air exchange there to keep levels from building up to dangers.
Okay. Something I think a lot of people don't think of right away, if your car gets stuck in the snow, you want to make sure that that exhaust line is open.
Yes, exactly. When we start to get significant snow, there are a number of ways you can get, the car exhausted. One, you can be stuck, as you said, or, if you're living in a place where plowing is going on, especially if you have only, say, side of the road parking in some of the urban places of Maine, and the car gets really sort of piled in there and you've got to go dig it out. There's a temptation to get it running at the same time you're digging it out, and then you get into the car and you can get poisoned that way if the exhaust is blocked. So whether you're stuck or whether you're plowed in, it's important to be checking that exhaust before you get that engine running.
You want to make sure your heat and dryer vents are clear.
Yes, absolutely. It's a good idea to keep on those vents during the course of the winter and make sure you're shoveling to keep them, free of snow so that they're able to keep the exhaust gases flowing out and not backing up into the house.
Okay. Any risks connected with fireplaces?
Well, let's talk more generally, really, about all heating sources. So whether it's a furnace or a fireplace or some other type of space heater, all of these are going to produce carbon monoxide. All of them have to be able to exhaust gases safely outside. So anything that results in blockage of those exhausts, again, that can be related to snow or other elements, anything related to cracks in them or some other malfunction in the device itself can release deadly carbon monoxide into the home. So one of the big safety messages there is, these sort of appliances or devices should be having their annual maintenance check. So, usually by a service technician who's going to check and make sure that the device is working properly, there's no cracks, it's exhausting fine, and that's just a good annual check to do. Remembering to make sure that your chimney is checked, periodically as well.
Okay. What did I miss, Andy? Anything?
Well, most of what we've been talking about is the important side of primary prevention, trying to prevent carbon monoxide levels from reaching dangerous levels. But there's a very important sort of, secondary prevention, which is in the event that happens, making sure that you have a functioning detector in your home to prevent poisoning. So the recommendation is that you have a carbon monoxide detector, and this is not a smoke detector. I'm talking about a carbon monoxide detector placed outside every sleeping area in the home. So if you've got a house that, say, perhaps has some bedrooms on the second floor and some on the first floor, then that means you should have at least 2 detectors, one on each floor outside those sleeping areas. If you've got bedrooms on 3 levels, then that means you should be having 3 detectors in the home. And ideally, the detectors should be ones that have a battery backup. So when the power goes out, you still have a working detector as you use some sort of alternative source.
Find more information on the Maine CDC website. I'm Cindy Campbell. Enjoy the rest of your weekend and stay healthy.
Join us again next weekend for Maine Concerns with your Town Square Media News team.
Attention real estate investors. Are you looking to diversify your investments in a growing industry and collect frequent income? You should check out Image Studios Salon Suites. We offer an investment opportunity where real estate comes together with beauty and wellness. We rent turnkey studios to beauty professionals and are on track to have over 100 locations open this year across the country. Image Studios is a unique investment opportunity, and we're building an incredible team of high-caliber entrepreneurs from coast to coast. We're the leader in the industry and poised for tremendous growth. Interested in owning your own Image Studios franchise? Contact us today. Visit imagestudiosfranchise.com to find out more. That's imagestudiosfranchise.com.